Hello Michael, welcome to Istanbul, AEK Clinic once more. So you've had a hair transplant 3 years ago, before the pandemic, and I assume you were happy, so you came again.
Very much.
Okay.
Very much.
That's good to hear. So before we say anything, I want to make a disclaimer here. I want to ask you, do we have any financial agreement or partnership in making this video?
No, as a matter of fact, I offered up to make this video on your behalf because of the good work you did.
Thank you very much. So that's important because, there's like thousands of this type of videos made and shared on social media in this industry, but I mean almost all of them are done within an agreement setting, which means obviously it's going to be biased. So here we want to try and explain that it's not biased. So first of all, why were you happy?
When I was advised to come here by a friend, his advice to me was to take your advice. And when we were drawing my hairline, and you said, I think this is going to give you the best look, I was hoping it would be a little further, but I took your advice. And when my hair transplant took place several months later, everyone complimented me on how good I looked and how natural everything looked, and they couldn't even tell I had a hair transplant. That's when I knew your advice was worth the time, energy, and effort to be here.
Okay, that's good to hear. So, obviously, every industry has a marketing environment, and obviously customers, clients, in this case patients, are trying to choose the best available option. So they're doing some research as much as they can do. I heard you are even reading alternative platforms like Reddit, Discord, and sharing on forums. Not many patients either have the time to do that or they don't even have the knowledge to do that. So they're doing more superficial research. So typically what they do is they will Google main keywords such as hair transplant in Turkey or hair transplant Turkey, which are the two main keywords. And then obviously Google will list a certain number of clinics depending on their rankings, Google rankings. And obviously Google ranking is a technical thing, it depends on your content, your links, etc. It's not actually relevant to the actual quality of the product. It's a ranking, technical ranking. So, but oftentimes what people will do is they will just look at the top listed 2, 3, 5, or maybe up to 10, and they will send an inquiry thinking, since these are the listed ones, these should be the best ones, and they will choose amongst them. Or what sometimes happens is when they enter these keywords, AdWords come up. And so the AdWords are listed on the top, and they will click, and they will send an inquiry to these companies. Obviously, when you do that, you cannot distinguish, which one is better than which and why, what are the qualities. It's just a listing on the internet. So oftentimes when that happens, it becomes just a price competition, because they assume it's a more or less standard product or a standard service, and let's just rank them according. Or they will just have an easy list of questions. I frequently ask questions they think they're going to interview, and decide upon these frequently asked questions. Now, I can't recall whether you asked any of those questions while you were deciding. You could tell me better. But I can say our company probably wasn't tortured by those questions when you were coming, because the way you came was a direct reference and direct research on your own. It was not done like a standard Google or social media search. So let's take a look at some of those frequently asked questions, obviously other than cost. Let's include even cost.
Sure.
Let's include cost. So I'm going to ask you, obviously we know the agreement between us, but I want to ask you a general question other than the exact agreement.
Sure.
And that is, from a patient coming from overseas, North America, Kansas City to be more precise, if I'm right.
Yep.
What is your take on cost? Since you did some research, you already had one hair transplant done, and you've come for a second one, how do you judge hair transplant cost? Like, what's your impression about cost in your own country? Obviously, comparing different qualities that you may have come up with.
Sure.
Like perhaps low quality, average quality, high quality. And then comparing that with Turkey. Obviously, everybody has a different financial situation and income. But, you know, let's say on average, our middle class, like all we are, let's judge cost from that perspective. Like, what do you think about the quality in your own region, in your own country? What do you think about price compared to that quality versus what you found when you came here? How can you look at, let's take a look at rough numbers. What's good quality, for instance, in your region? How much is good quality, if there is? What's average quality? What's low quality?
So in Kansas City, when I first inquired about a hair transplant, they quoted me $16,000 US. And I thought, okay, that's quite a bit of money. And I got online, and of course I found your clinic. But my problem between paying a lower cost, just a lower cost, versus the high cost in the United States was I was looking for value. And value comes when you have quality and cost. And I felt that with your portfolio of patients, with the direct recommendation that I got from someone else, for which I am more than happy to give that same recommendation and answer questions to anyone else that would like, someone that has been through this experience. So I think, to answer your question, this is a cost-effective alternative to what's in Kansas City, whereas I don't feel I am foregoing a lot of quality. I don't know many other people that have had hair transplants and hair transplants in Kansas City or the United States. All I know is when people talk to me, they say, I don't believe you had a hair transplant. And that is the quality. And that is the value.
Okay, so let's say, I mean, I assume you didn't do a lot of research about local options or like going to another city. But let's talk about that $16,000. So what was your impression? Let's say you were willing to pay that $16,000.
Sure.
What was your impression? Obviously, you didn't go through it.
Right.
So you don't know it. But what was your impression about the quality you would receive for that price, like low, average, or high quality?
Well, I assume it to be relatively high quality, but in the United States, there's not a lot of competition. Okay. In Turkey, there's a lot of competition, but I cannot speak to the varying level of quality. I can speak to the quality I got here, which has been wonderful. But in Kansas City and the United States, there wasn't a whole lot of variety and price competition to make it more affordable. But again, I can't necessarily speak to that quality, though in general, they're known for quality product.
Okay, good. Did you consider other clinics in Turkey other than our company when you were first considering?
Yes. I was comparing your clinic with several other clinics that had similar price points. But I thought, interestingly enough, they had very, very aggressive marketing. And I know that when you dedicate marketing dollars in your organization, sometimes that forgoes quality. And because I got a personal recommendation, because I was able to look at your portfolio, because I was able to talk to your team directly via WhatsApp, they were very responsive, they were very caring. I felt very comfortable stepping out and going to the other side of the world to have work done by you.
Well, thank you for that. So what was the price range you would be looking at? I mean, so you did contact a few other companies. So with regards to hair transplant in Turkey, what would you consider the price range for quality services in hair transplant, and what would you consider would be going into the danger zone and like entering low quality? Do you have any take on that?
Sure. You know, in Kansas City in the United States, I was starting with a baseline of $16,000. And my thought was, if I could get in the area of about a third of that, about $5,000, I would expect high quality work with still a very good value. So as I worked with your company, your prices were right in line with my target, and I appreciated what we settled on, and I could not be happier.
Okay.
Does that answer your question?
It does answer, and
Okay.
so here's what's sometimes happening. Okay, so like I do know many clinics in North America, including Canada, and I would say if the clinic is extremely famous, you could talk about 20,000,
Sure.
25,000, or even more. If you talk about somewhat reputable, those numbers would be the numbers, like around between 10, 15,000. And then there would be either no name or really the danger zone would be
Right.
if you're going down four figures. I mean, if you're talking like 7,000, 8,000, 5,000, that's the danger zone. Perhaps some may have reduced their prices because of the international competition, but I would say if you're going down to four figures in North America, that's the danger zone. So there are oftentimes we have candidate clients contacting us and getting these prices, the average, I mean, we have a range of prices for different techniques.
Sure.
But let's say the average $5,000-$6,000 range. And when they receive these, oftentimes we get this answer. Well, for that price, we could get a hair transplant here. Like 6,000, or, you know, I'm going to fly over, pay you 5,000-6,000. I'm going to buy a flight ticket for 1,000 all the way to the other side. I could get a hair transplant here for 7,000, 6,000. And now, how if like you had to answer that question, how would you answer that question?
Yeah.
So they decide not to come because they think there's no point in coming over here because they think there's simply no price difference.
Sure. If price is your only concern, you're not giving careful consideration to the product and the advice and the art that a doctor that like yourself that was trained in North America, if I'm not mistaken?
I wasn't trained there, but you know, I do go every year or two for the World Congress.
Sure.
I'm American board certified.
There it is.
And so I'm invited. In fact, even this year, I'm invited to lecture at the American board basic course for the doctors. So I'm in close relationship, I would say.
Well, what I would say is I would rather pay a fair price for that professionalism, fly halfway across the world, still save a few dollars, and get the professionalism that I've experienced in this clinic. If your only determination is price, you're going to get what you get.
Okay. So let's finish the price topic. It's not the most fun, but
Sure.
I couldn't avoid that topic.
Sure.
So the next frequently asked is, they will hear about techniques and instruments. Okay, so and this is what most I would say low quality companies will do. They want to take the emphasis off the personal service, off the actual labor of the doctor and the team, and make it like a technological product, like the latest invention or something like that. And say like, we have this technique or we have this latest machine or something like that. So then patients will come up and ask, do you do DHI? Do you use sapphire blades? Do you do PRP? Do you do whatever? Do you use this blade? What's the size of your punch? And we get a list of questions like this. And so how do you approach that type of did you ask those questions And if you did, which ones and why? And if you didn't, again, why?
No, I didn't. I don't care how the sausage is made. I just care that it's delicious. Okay. I don't care what techniques you use. I care about the final product. And the final product, in my experience, was outstanding. Therefore, I'm going to rely on you, the professional, the doctor, to use the techniques that you are comfortable and capable of using to get the results that I got. So did I ask those questions? No. I just assumed you knew what you were doing, and in my experience, the answer was a resounding yes.
Yeah, I agree with that opinion. The problem is people fall for this type of cheap marketing, I would say,
sure,
that wants to take your concentration off the actual people who are going to do the job and just make it like a technique or a technology that's actually the miracle. And so, I mean, let's say if we go to a Michelin star restaurant, are we going to ask what's the brand of your knife?
Right.
Or how many grams of minced meat are you going to put in the food?
Right.
We're not going to ask. I mean, if we trust this restaurant and the chef, we're going to go for it. And if we were right in choosing this place, we're probably going to like the food. If we were wrong, we're not going to like it. But asking about those questions is not going to lead us anywhere or help us in any way. So that's one of the things.
Well, you know, along those lines, I'm very, very fortunate that, as it turns out, I was informed the same team that did my procedure last time will be doing my procedure this time 3 years later, which I think speaks to the viability of your practice, and also was incredibly good news for me because I enjoyed, again, the work they did.
Okay.
So, again, technique, marketing, none of that mattered. I had a solid team that is doing it now twice, happily.
Okay. So another very critical and very frequently asked question is, okay, so since hair transplant surgery is a team's work and can't be done by a single person, no matter who that person is, including a surgeon,
right,
needs a team that all contribute to the job. So oftentimes we get this question, who's going to do my surgery? What parts of the surgery is the doctor going to do? How much is the doctor involved? I understand that question because, you know, now people learned that there are a lot of cheap options,
right,
which do not involve trained medical staff.
Right.
Okay, and we call the assistants in hair surgery technicians. So patients have just learned it in a way. So they ask, is my surgery going to be performed by a doctor or technician? How much of the work is going to be done by the doctor? Before I do any explanations, I want to ask you your opinion about that question. Did you ask that question? And what's your takeoff about when that question is asked? How do you judge that question?
I did ask that question very directly to you on my first trip, my first hair transplant. And you helped explain to me what your role is and what the role of the technicians are. And again, now fast forwarding to this trip, it speaks volumes that you have the same technicians that you did the last time to help me this time. And I trust your judgment, I trust your training, I trust their training and their guidance by you as a doctor to help and assist in the hair transplant process. Other than that, again, I'm focused on the product. And what I was happy with was more than enough to make me come back.
Okay. Yeah, actually what you initially said was, I think, very critical, and that's value. So everybody, whatever you're buying, it doesn't matter if you're buying a car,
sure,
a hair transplant, or food, you're looking for value. And value is cost and quality at the same time.
Right.
So the debate on, we even get patients asking, as a matter of fact, I even had a medical doctor inquiry who was asking for a hair transplant and was asking for me to do the whole procedure without any assistants or technicians helping. I was unable to explain that's physically impossible,
Right.
and totally unnecessary. So it is a problem that's going. But here's the thing. I will try to explain it very briefly, okay, about a doctor. What would happen if a doctor would try to do all or most of the job, okay? Number one, it would totally become unpriceable, because I would have to complete this very hair transplant would take me 1 week to finish. You'd have to go through surgery for like 5-6 days in a row so I could finish it. It wouldn't be better. It wouldn't be practical. It would be worse, probably. I would not have the physical ability to take so much physical pressure on my eyes, on my hands, on my spine, and simply there would not be any added quality because I did the whole procedure. So I don't think that's the way to look at it. It's not like the more the doctor does it, the better it's going to be. So, and considering no added quality plus totally unpriceability, it's just impossible. I think it's a totally irrelevant question. More relevant, in my opinion, is number one is who are the team and what are their practice settings and training backgrounds. Like, I bet almost no patient in the world who went through it or are considering it yet do not know that 99% of the hair transplant industry in Turkey is totally outsourced, no-name labor. So there's freelance technicians with unknown training. They learned it from each other. So nobody trained them. They just learned it from someone else, again with unknown training. So they're daily recruited. Okay, so you just pay them daily, and they just come in and do the hair transplant. So all you need to do is have a marketing and sales company, and once you make the sales, you just call those, and they'll do it for you. And I'll tell you the cost. It's like $100 to $200. You just have to pay them $200. You have to pay the hospital room rental $100 more, so it's costing just $300 for the company to provide you with an outsourced hair transplant. And this is like 99%. I'm telling you, it's not 50%, it's not 70%, it's 99%. Okay? So these are technicians from unknown training backgrounds, not like us. I trained each and every technician we have, and I will never use anybody who was trained elsewhere or with unknown training. In fact, I even refuse to employ candidates who have previous experience because they're spoiled. I would need them to be fresh, so they learn it. So I am totally unable to explain this to the public. This huge difference. They're fixed. Is it going to be the doctor or no? Forget that. I'm talking about totally outsourced. With no quality versus a full-time team with known training. That's the huge difference that patients need to understand. And it's also very easy for them to recruit a no-name doctor that are even ready to do some parts of the procedure, and so he can pretend that he's doing it, even do some parts, but that doctor has no training. So the fact that it's a medical doctor, is that adding any value to the procedure? No, in my opinion. But when asked that way, yeah, that's a doctor. But that doctor doesn't even know anything. He has no clue about what's actually being practiced here.
Well, that speaks to my earlier comment where I was relying on you for the advice for my hairline, for where I needed touching up, and your team. The fact that you still have the same team now that I had when I had my previous surgery spoke volumes. You have no idea how relieved I was, because exactly what you just said was my experience as the patient.
Mm-hmm.
So I appreciate that.
Okay. Yeah, I think, that these were my main questions. I mean, this could go on forever. But I think we have touched on the most important, like cost, frequently asked questions, techniques, technologies, magical inventions, how irrelevant they are.
Sure.
And the doctor, is it the doctor or the technician, this type of questioning, when you ask the wrong question, you can never benefit from the answer. This is the problem.
I wanted to add, I'm sorry to come back to your team. When I had my first hair transplant, I am incredibly attuned to what is happening around me. That's just my nature.
Mm-hmm.
And when I realized that there were at any given time at least 3 people in the room
Mm-hmm.
handling the extraction, the sorting of those follicles,
Mm-hmm.
Ultimately ordering those to go in strategically into my hair,
Mm-hmm.
I noticed that. I realized I was laying back and my head was numb and all of this, and I was experiencing being a patient, but I was watching, and I very much appreciated that whole team. And I want to thank you again, Doctor. For the
You
most
are
part.
welcome.
You did a great job, and I'm happy to come back, and I'm more than happy if you want to share my WhatsApp information with any American or Canadian or English-speaking person that would benefit from me giving them a little bit more confidence to get a hair transplant done. Quite frankly, to consider you, I'm happy to do it.
Well, thank you very much as well. I mean, I wouldn't even dream of someone employed doing that. Forget doing it just for the sake of humanity, which I'm sure some are going to doubt, but here you are. And if anybody calls you, you can tell it. There's no financial agreement, nothing, and it's just for helping people. And again, thank you very much for allowing us to share your experience with everybody. Okay? Thank you. Okay.
All right. Well, hello, Michael. We're finished. So how are you? Are you okay? Apart from being extremely exhausted from the long and difficult journey you had. Thank you again for coming. So how do you feel? Are you okay other than the tiredness?
I feel the tiredness and the long journey was worth the experience. I'm very optimistic that this is going to be the look that I'm ultimately going to want, and I feel good. It was relatively painless from after the anesthesia was administered. There was no pain. Your team, of course, was wonderful and great.
Okay, that's good to hear. Well, I mean, we need no further questions. So thank you very much for coming. I wish you a very good journey back.
Thank you.
Keep us updated with your results. I hope you get a fantastic result. Okay, then, thank you.
Thank you much.
Okay, bye-bye.